Thanks for being here, everyone. I'm Jen Harris with Montgomery County, and of course, joining us is Dr. Bissell. She's here to give a brief overview of what's going on right now, and then we'll take any questions you may have using the chat or the Q&A. Thanks so much for being here.
Thanks, Jen. Good morning, everyone. Thanks for changing the time a little bit. I have to be someplace this afternoon. We're still here, right? Across the state, across the country, COVID cases are definitely dropping. VHHA shows overall that hospitalizations are down as well. Again, in different local areas, they may lag a little bit. Here in the New River Health District, we are seeing a decline. We were hoping it would be sharper this week, but we do expect in the next week or so that it will be a much sharper decline, as we've seen in other places like New York and some of the more populated areas, Northern Virginia, some of the more populated areas that saw Omicron surge a little bit sooner than we did. Heading in the right direction, continuing to push vaccination as those who are hospitalized. And again, we don't have the breakdown of those who are hospitalized for COVID versus with COVID, but those who are hospitalized with complications of COVID overwhelmingly are those who are not vaccinated. So we're continuing to push vaccines, trying to get out and make sure that everyone has the opportunity, doing a lot more of that one-on-one, more personal engagement to discuss any concerns or hesitation people have and meet them where they are, which is kind of the grassroots public health that we're used to doing. We talk a lot about the changes over the past couple of weeks. I think the most important thing is that VDH did announce that the change in the contact tracing case investigation and doing more of a surveillance with COVID like we do with flu and other communicable diseases. And that really is, that really is kind of the way public health does it. It's become such that the cases are far higher than we can really manage, and so we do have to prioritize, and we have to hit those outbreaks and really focus on those people who are at higher risk, and we'll continue to do that. We'll continue to support our long-term care facilities, which is where we know people are extremely high risk because of the older population and those with comorbidities. We'll continue to support our other congregate living areas like our residential facilities, our jails, and then obviously we'll continue to really support our schools. They've all done a great job staying in session during all of this, and we want to continue that. We do see brighter days ahead as Omicron wanes and as the spring comes and weather improves. And then we do have to be prepared that we will see another variant and we will see COVID again. It's not going to go away. So we really do have to be prepared. We continue to see improvements in therapeutics, and we look forward to more and more therapeutics hitting the market, as well as vaccines. There are other vaccines out there being developed, and we're hopeful that they'll hit the market. We'll have to make adjustments. Do we get annual boosters like we do with flu vaccine, or does the immunity from the current or newer vaccines prove to be much longer lasting? And certainly we need to look more at that as we're living it real time. And we need to look more at people who've had COVID. Again, when there's a vaccine, we endorse getting vaccinated, but we can't deny. We have to acknowledge that those people who have had COVID do have some immunity there, and probably those who've had COVID and then had a dose of the vaccine are probably set up with the best immunity. And remember, as we've known from the beginning of the pandemic, the numbers that we're counting are far less than the actual numbers of people who've been infected. Earlier on, it was maybe 2.5, 3 times, and now it's looking, with Omicron being so transmissible, that could be as high as 4.5 to 5 times. So I think that's really all I had. I'll just address questions.
Thank you. Our first question is coming in from Eric. Some college campuses are seeing a rise in cases. In the past, they've been able to survive the first few weeks, and then cases have gone down. Do you expect the same pattern this semester?
I do. Our college students are vaccinated. Many have had COVID before. Omicron, we are kind of in the peak of our surge. So we expected to see an increase in cases everywhere. and that includes, our college students. I did say that, our college population coming back right around the surge time might affect our curves a little bit, but not significantly so. So again, we do expect the curve we've peaked. We do expect the curve to start coming down, and that's across the board. So I don't expect that we'll see any significant prolonged effects from college students.
Eric has another question. Is there anything the CDC or other public health entities could have done to build confidence in vaccines?
Well, I think one of the biggest problems with our public health messaging from the get-go was a lot of times it tended to be confusing, and sometimes it was conflicting. I think one thing I hope we have learned from this is that as we live at real time, it's okay to say that we don't know, that we're making our best educated guess. And it's also okay to admit, hey, we were wrong, we misjudged this, our assessment was wrong. I think that builds more trust than trying to kind of explain your way out of it and getting deeper and deeper into it. So as far as the vaccine goes, I think there was a lot in the beginning about the vaccine being developed too quickly, and even some of our public officials talked about the vaccine being developed too quickly, and they didn't trust it. And then when we rolled the vaccine out, we had a lot of high hopes around the vaccine, and with good reason, that the trials showed that it was very effective. But to put all of our hopes on the vaccine being this miracle end to the pandemic, and then finding out that that it wasn't stopping transmission, especially with the newer variant of Omicron. However, it still really is holding up very well to severe illness, hospitalization, and death. And so, that's the message that we really want to be getting out there, not so much about the quote unquote breakthrough cases. We do this with flu every year. You might still get the flu, but if you don't end up in the hospital, if you don't end up dying, that's a public health success. I think the other thing is being more transparent about the vaccine, what we know, what we don't know, the potential side effects, acknowledging the vaccine is safe, it's very low risk, it's not zero risk, not trying to dismiss that, not trying to dismiss legitimate concerns about the vaccine or any other medication safety. So I think those are all things. And then in our messaging, to acknowledge that, I think is important as we're trying to kind of filter through the misinformation, the disinformation is out there, because there are some legitimate concerns. And when we don't address those, when we don't acknowledge those, then all of these other things that are out there that are misinformation, it all kind of gets lumped together in a lot of people's eyes. And the more confusing and the messaging gets, I think people just throw their hands up and aren't sure what to do. So, the vaccines are still very effective. Newer vaccines are being developed. Vaccinations as a whole save millions and millions of lives every year. They're not perfect. Everything is, you have to weigh risks versus benefits. There is nothing that's zero risk. And I think that's another thing is, whether it's a zero COVID mentality or a zero risk mentality, that's just not possible.
Thank you for that. We have, it appears to be 4 questions in the queue. So again, if you have questions, feel free to ask them in the Q&A or the chat. The first 3 are related to colleges and universities. So Jenny has a 2-part question. I'm going to go ahead and ask both parts real fast here. Jenny's asking, what is your opinion on universities mandating vaccines or boosters for COVID-19 in light of the recent announcement by the Attorney General that vaccines and boosters cannot be mandated? And why are vaccines and boosters still important in these settings?
So yeah, that's kind of been a change from our prior Attorney General. And I'll have to say, when the vaccines first came out, and we knew that a lot of our initial cases of COVID pre-vaccine were in our college population, and spread very quickly. So when the vaccines first came out and they did look like they were decreasing the spread, it made sense that we really needed to me, it made sense that we really needed to encourage mandating vaccines in a population that's at high risk of spreading the infection. They are overall a very low risk population from COVID, however, and so you try to balance, again, it's a risk benefit analysis. You try to balance, you want to try and decrease the spread as much as possible. The vaccine helps decrease the spread. Things changed, however, and we did learn that the vaccine, and even those who are vaccinated and boosted, are still getting COVID. So that's another factor to consider. The other thing is a lot of our students had already had COVID, and we really don't have a good seroprevalence survey. One of the things the United States really lagged on compared to other countries was doing seroprevalence surveys to see how many people. We keep saying that we know that there are far more people who've had COVID than we've actually documented, and yet we don't have good seroprevalence surveys. So, when you start to consider that, and then you consider, again, that the vaccine is low risk but not no risk, and there are certain populations, including young adult and adolescent males, who might be at slightly higher risk, then that risk benefit starts to shift. So, I think then that's where we have to look at, what is the benefit of the vaccine? And again, I think individuals need to do their own risk assessments and their own analysis, and situations are different. People who've had COVID and have had either 1 or 2 doses of the vaccine are very well protected. People who've had just 2 doses of the vaccine in that very young population are very well protected. So as the plans about boosters came out, I think the calculus had shifted somewhat. I think that's reflected in some of the current thinking across the board about not only vaccine mandates but booster mandates. As I said, unfortunately, the politicization has happened. Unfortunately, there's a lot of misinformation, disinformation, and unfortunately, there hasn't. Public health. One thing I'll say is that there isn't now, and there never has been, complete public health consensus on a lot of these policy issues. And I think sometimes we tend to conflate policy with science, and I think that dissenting opinions need to be addressed openly. There needs to be that discussion, as opposed to just suppressing them in the name of a fake consensus or a false consensus. So we can have that discussion, we can have that respectful discussion to dissenting opinions, and that didn't all quite happen. And social media has really changed that. The politicization has really changed that. So I think it's been unfortunate that we're put in this position right now. I know we all want the pandemic to end. No one wants that more than those of us in public health. As we look at science versus policy, science is supposed to be the irrefutable facts, the unbiased, irrefutable facts, and you acknowledge the certainties and the uncertainties of the knowledge you have. And you also have to acknowledge the assumptions that led to the conclusions. Policy inevitably is going to inject some values in that. There are going to be trade-offs, what's considered safe, what's considered right. And different people are going to have different opinions, in different populations. And so those things often get confused. But I mean, the bottom line is you cannot look through just a COVID lens. There are trade-offs. Zero COVID is not a possible outcome. And we knew that relatively early on, that we were not going to be able to totally suppress COVID. So that's not a possible outcome. So then you have to look at those trade-offs. You have to look at a risk-benefit analysis. You have to look at protecting those who we know are at the highest risk of COVID. And so all of that needs to be considered in policy. And where we are now, and as we are looking more towards the endemic phase, as the Omicron surge starts to subside, and our numbers overall are heading in the right direction, we need to realize that there will be future variants, and how do we address those, and how do we live with those? And I think there's no question that the vaccines are protective. They are protective against hospitalization and against death. You know, and those who've had COVID, they have some immunity there. So we really need to empower people, and that's what, you know, the joint statement from the Council of State and Territorial Epidemiologists and NATRO came out and said we need to empower people, as it's no longer possible to do individual case investigations and contact tracing. People need to be empowered to make their own decisions, and to protect themselves, and take care of themselves to minimize their risk from COVID. And people's risk acceptance is going to be different based on where they think they fall. And remember, low risk is never zero risk. So somebody who might be low risk might end up with a really serious case, but it's kind of the odds there, and that's going to inform people's behaviors. There were a lot of questions about the masking and everything, and the CDC came out and acknowledged that cloth masks really aren't helpful with Omicron. That certainly surgical masks are better, and there was a big study out of Bangladesh that reinforced this. There is a method with the knot and tuck for surgical masks, N95 masks, but the bottom line with masks is the fit is really important, and you have to wear it properly for it to be effective. But we're now shifting to, and we have data, we have data that shows that the universal masking concept really wasn't as effective. And so we really need to look at those masks as protective for us. The Bangladesh study showed that. And then, when we look at data from states that had, and countries like Israel that had high vaccination rates, high boosting rates, extremely high masking rates, New York, versus some of our states that didn't have those, that the spread of Omicron is still pretty exponential, even in places with all of those mitigation strategies. In the schools, there's no significant change there. So we sort of have to change that messaging that Omicron is here. Even the CDC, Dr. Fauci, they were all saying that everyone is at risk and eventually everyone will likely be infected. So we have to inform our behavior with our risk assessment and what we're willing to tolerate. And I think that's a big transition. And we do that with all of our other communicable diseases. So it's a big transition.
Our next two questions are coming in from Jean. If the COVID vaccine mandate goes away for local colleges per the Attorney General's recent opinion, are there worries that student infection rates will spike?
Well, I mean, even in very highly vaccinated communities, infection rates have spiked. As I said, look at Israel. Israel is the most vaccinated and most boosted country, and they are still struggling with the Omicron surge. So, I think the infection rates are surging under Omicron no matter what, because it is so highly transmissible. So no, I don't think that we're going to see any significant change there. And as I said, a lot of people in public health want to get away from just looking, solely at case counts. Number one, because we're far undercounting them. They're just, enough people are not getting tested. People are not reporting home tests. People who have symptoms don't want to get tested because they may then have to isolate or something. So there are a lot of reasons, but the case counts are not reliable. So we look at hospitalizations, we look at deaths, we look at those other metrics. And certainly when you have something like Omicron, even though, all of our data suggests that it is overall less deadly than Delta was, it's so much more transmissible. When you have a significant number, a significantly higher number of cases, there are definitely going to be more people ending up in the hospitals and straining the hospital systems for sure. And that's what we've been seeing, although there is some, some hope that our numbers overall in the state are going down, and hopefully individual localities where the hospitals are still strained will see that effect as well. So by sheer numbers, those numbers of hospitalizations, they definitely have gone up. They've surpassed what we had last year during the surge pre-vaccination, but they have not gone up proportionally. And so it's looking at the numbers, it's looking at those percentages, because Omicron is several times more infectious. So we know that we have several times more cases. But the hospitalizations and our deaths have not gone up proportionally to that. So that supports that Omicron is not as severe. So those are the metrics that we really need to be following. And to be honest, in the very beginning of this, when we came out with that whole 14 days to flatten the curve, that wasn't so much like, oh, we need to try and stop COVID at all costs. That was, let's spread the infections out so we don't overwhelm our healthcare systems, because we need our healthcare systems to be there for us to take care of those of us who get COVID, but to also take care of those of us who have all kinds of other medical problems. So what we found is zero COVID is just not possible. It's kind of kicking the can down the road, so to speak. COVID is still out there. And we're not going to totally suppress it and make it go away. So we have to do what we can to kind of spread things out, to keep things controlled, because of our hospital systems and because of people needing medical care for COVID, and for other illnesses.
Okay, we have about 3 more questions in the queue as it stands now. Our next question, also from Jean. So some businesses are still insisting on a 10-day isolation period instead of just 5 days per recent CDC guidance. Are they being too cautious?
Again, it's up to individual businesses, and too cautious is a relative term. What you think is too cautious and what I think is too cautious may be different from what they think is too cautious. So I think we do know that most people, again, it's not an absolute. People tend to want to be in the absolutes here. It's either all or none, and it's just not that way. It's somewhere in between. We do know that most people are not going to be infectious beyond that 5 days. Yeah, our data shows us that the period of greatest infectiousness is probably just before the onset of symptoms to a couple of days after the onset of symptoms. So we know that most people will probably be fine to be out of isolation at those 5 days. If businesses want to be to be more cautious and say, we want you out for 10 days, there's nothing wrong with that. If people individually want to stay out for 10 days, there's nothing wrong with that. Remember, the 5 days of isolation isn't tied to a test, although, testing is definitely becoming more available. I know people who are finding tests in the supermarkets and on the pharmacy store shelves, and the government's website opened a couple weeks ago, so people should start receiving those tests from the federal government. Certainly those who have had COVID and, if they want to go out of isolation on day 6, test on day 5, but be careful what you wish for, right? So if that test is positive, then obviously would recommend staying isolated until that test turned negative, because the antigen tests, if they're positive, you probably still are infectious. If the test is negative, then I think you can feel more comfortable going out. But again, no test is perfect either. People who are, their symptoms have totally resolved, or people who were never symptomatic, again, their risk of being infectious to where they're transmitting the infection is probably extremely low. It's never going to be zero, but, again, playing those probabilities. So this is where those policies and those values come in. I think we have to acknowledge that it's not all or none, and that it's not as cut and dry as people tend to want to make it.
Okay, our next 2 questions are coming in related to K through 12. First, coming in from Paige, with school districts dropping the masks mandate in classrooms, Should we expect to see a spike in infections for those students?
So again, I'll go back to the curve for infections in children has followed community spread from the beginning, whether school was remote or in person, and now even whether schools have mask mandates or they don't have mask mandates. And again, I'll point to, you can pull up the curves for infections in children. It's on the CDC website. And you can pull up states that have mask mandates, such as Virginia, such as Maryland, New York, California, versus states that didn't, such as Florida, Texas, South Carolina, Georgia. And those curves are essentially unchanged. And the incidence of disease in children is really not markedly different. So, I think that's what we've seen. And same thing in Israel, right? Again, highly vaccinated, boosted, highly masked, still seeing Omicron surges. So I think, masking, again, it also depends on the quality of mask and the fit of the mask. N95 masks were never meant for children. They were meant for healthcare workers. They were meant for occupational use. So obviously, I don't even know, I've never seen one, a child N95 mask. Surgical masks initially were not made for children. I do know that companies have pivoted and made surgical masks to fit those smaller faces. And as we talked about, the knot and tuck method does help with that fit for the mask. But cloth masks, we know with the Omicron variant, is not doing much. They're not doing much. And even the data from Bangladesh showed us that pretty well. So if you look at schools, you have a lot of children wearing those cloth masks, which really aren't super effective. The compliance, especially in some of the younger children. And to be quite honest, even just something, if you had a cloth mask or any mask, and children are wearing them all day, and they're getting saturated, and they're getting wet, and they're getting full of all the other, things that children carry in their nasal passages in their mouth, and they become less effective as well. So there's a lot of things that go into it. And, again, that's why we need to look at the fact that the curves weren't that much different in places with them versus without them. So we need to pivot to, if the mask, you feel that the mask is right for you, is right for your child, make sure it's a good quality mask. Make sure you can get that fit as best you can, and that's what you can use to help protect yourself. You can help use to protect your child. Again, our children are extremely low risk from COVID. We do have vaccinations available for those 5 and above, which is pretty much all of our school-age children. All of our teachers have the opportunity to be vaccinated and to be boosted, so that takes the risk down very low there as well. And so, the outcomes, when you look at those outcomes, since we've had vaccination, things have changed tremendously for our adults, for our faculty, our staff, and bus drivers, cafeteria workers, and everyone else. And then again, even unvaccinated, our children were extremely low risk, but now with vaccination, they have that added layer of protection there. And Omicron cases are surging everywhere, regardless of the masking.
So Rachel has a couple of questions related to K through 12. First, how are our schools in the NRV faring in terms of cases, COVID cases at this time?
So just like the rest of the NRV, our schools appear to have peaked, and the cases are coming down. So that's kind of to be expected. As we follow community spread, that's our K through 12, our kids' cases follow our community spread. And that's been true regardless of whether schools were in person or virtual. And that's, some of our school systems have gone to the masking optional. It's been a couple of weeks now. We haven't seen surges in those districts. And remember, I'm covering all the way down to the Southwest. We have not seen surges in those districts. To correlate with that, we'll continue to follow it. Here in the NRV, we have peaked and are starting to come down. We do expect to, we were hoping this week they'd be down more, but I do think by next week we should start seeing more of a decline. Further southwest, they seem to be right at their peak in the past week or so. Their rate of increase of cases was significantly down compared to the prior couple of weeks. So that's always a sign that you're hitting that peak and expect things to decline. And a lot of those school districts went with, the governors making masking optional. I will say, even in the ones that made masking optional, there are still children who do mask. And I think that's the way we need to look at this. Those parents, those children, they can certainly continue to mask. One of my biggest concerns, quite frankly, is, as the surge abates, those students that still do mask, I don't want to see them get bullied by other students who are not masking. Masking, the fact that it was so politicized, I think it has just been so wrong, because it's not one of those things that that I think we should throw away in times of a really big flu season. And, if we start to see surges with COVID again in the fall, which we fully expect we'll see COVID again as we're entering the winter months again, people can pull out those masks and use them. And people should have the choice to do what they feel most comfortable to protect themselves and not have anyone judging them or bullying them. And I think that's one of my biggest concerns right now. But so far, in all 21 localities that I'm covering, some of them have stuck with the masking mandates, and my understanding is there has not been a lot of contention around that. I mean, there are definitely people who disagree with it, but my understanding is we haven't had huge issues with it. There are definitely school districts that have made the masking optional, and they have children who are not masking, and they have children who are masking. And so far, over these 2 weeks, I would say that we have not seen a significant change in our cases that bucks the trend to suggest that masking change has made a difference.
Okay. Rachel's also asking, can you speak to how educators are working with you and your team at the New Rural Health District to control the transmission and keep kids in school, especially now that this exit strategy seems to be in place for face coverings? I know you spoke to that a little bit, but
yeah, so we continue to work very closely with our schools. I think all of our schools know to reach out to our school liaisons or to reach out to the health department directly. I have a weekly superintendent's call with all 21 localities, and then we do locality specific calls where the health department is speaking with the superintendents and the school nurses. They all have access to testing in their schools, the VISTA program, and I think most of them have taken advantage of that, so they have the rapid testing. VDH did come out with the change in strategy to more of a surveillance one, where we're not doing individual case investigations and contact tracing, but we're focusing more on outbreaks, and especially in those high risk settings. So schools now, they're not mandated to report individual cases. They're to report outbreaks. And to be honest, they're not going to be doing the same degree of contact tracing either, just because you can't continue to do that at the level that we were in the very beginning. And to be sure, as I said, we never were able to fully case investigate and contact trace every case. That we never have been able to do that. But certainly with Omicron, it's gotten even that much harder. So the schools are watching out. The biggest thing, I think the biggest thing for everyone is, if you're sick, stay home. Stay home from work, stay home from school. If you know you've been in contact with someone, please, take appropriate precautions. Stay home if you can. If not, please make sure, that you're monitoring very closely for symptoms. I think that's one of the biggest things to keeping our kids in school, to keeping businesses functioning, to keeping people functioning during this. And then our schools will keep tabs, like we do with flu. If more than 10% of the student body is out, we often look at that as an outbreak, and we'll dig in a little bit deeper to see what's going on. If cases in smaller groups within the schools, whether it's a sports team or a classroom or something, if there's multiple epidemiologically linked cases, then we'll look at, was there transmission occurring in school? And that epi-link is really important because, just because you have 3 or 4 cases in a classroom doesn't mean that they were acquired in the classroom. And, again, we know that our children's cases is tracking community spread. We know from the beginning of the pandemic that the vast majority, or the biggest part of transmission occurred in the home. We know that in states that have mask mandates in schools, those children are not masking at home, and they're not masking when they participate in their other social activities, whether it's birthday parties or they're carpooling to an event. So we do know that that's where the transmission is happening more than a more controlled setting. I think the biggest thing is we continue to work very closely with our schools, and we'll monitor for trends. Certainly if it looks like there are outbreaks happening, we'll address them quickly to mitigate. And there is no elimination. It's all about mitigation. And then we'll continue to push the message that you need to stay home when you're sick. We'll continue to push the message that we know that the vaccines work to prevent severe illness, hospitalization, and death. We'll look forward to more therapeutics entering the market. We'll look forward to different vaccines. Again, I think that could be helpful if we have some vaccines manufactured on more traditional platforms.
That appears to be all the questions that we have for today. As always, we really appreciate your time, and we hope everyone has a great Monday. Thank you.
Thank you all.
I might have spoken too soon. Nope, we just got to thank you. Thank you, Eric.
Okay.
Everyone take care.
Thank you all. Have a good afternoon. Bye-bye.